Amy Alton here, also known as Nurse Amy from doomandbloom.net and also store.doomandbloom.net, where I have all kinds of first aid kits that we hand pack. Myself, I'm a nurse practitioner, and my husband, a medical doctor, have designed a whole line of medical kits, and today we're here to talk about our minor wound care kit. And let me just show you the bag first because it's kind of cool. It's actually a canvas mechanics bag, and it's sort of a GI style is how they put it. And it has two flaps in the front. I don't necessarily pack anything in these, but it gives you extra space in case you'd like to add some extra things, some tools, or a multi-tool, whatever it is that you want to put in your bag. You do have extra space, which is kind of unusual because most of my first aid kits are fully packed. You don't necessarily have a whole lot of space in them. So that's really, really cool that you get a little extra space. It has a heavy duty brass zipper, and I have to say, this is pretty amazing. It's really, really solid. I don't think you're gonna have any problems with the zipper. Inside you have tool holders if you want to, again, add some extra tools. I don't really pack things in there, so it gives you some more space for organization. But it's really cool. It's got two handles. You can carry it here. It also does have shoulder strap attachments. So if you do have a shoulder strap or you want to get one, certainly you can add that to the bag. We have 40 nitrile gloves. We're really careful about not putting any kind of gloves that may cause latex allergies, so we make sure we put hypoallergenic gloves in all of our kits. Pretty much, I don't think there's a single kit that I make that doesn't have some form of hand sanitizer. Really important, especially in today's world. If you're going to be touching an open wound, and again, this is a minor wound care kit, you need to take care of your hands. If you can't wash them, which is the best thing to do, wash your hands really well. At least do some hand sanitizer. If you can do both, wash your hands and do hand sanitizer, and then put the gloves on. Remember, you're not protecting yourself so much as the person who has the open wound. They're the ones who are susceptible to getting an infection. And the whole point of a minor wound care kit is to prevent infection, to help it heal the best that it can. So these tools, this equipment, these items in this kit are to help with healing and to help prevent infection. So let's take a look at what else we have in. I do have one option. We'll go ahead and talk about that at the beginning. You can upgrade and add a chitosam. Now this chitosam is a hemostatic gauze. It's open for me because I keep it in a Ziploc bag in the kitchen because that's where most of our cuts occur. And this is actually an interesting material. It's really soft and plush. You can actually tear off a piece. Let's say you have just a small wound that you need to take care of on your finger or your hand or wherever. You can push this on. You want to get it in the wound directly on the blood, on the vessel that's bleeding, for at least 3 minutes. So you want to put firm pressure towards where the blood vessel is, and that's going to be towards the heart. You'll always bleed from the heart. Push that in 3 minutes. If you want to, if it's something minor on the hand, you can leave this on and go ahead and just put a Band-Aid or some tape over it or a piece of gauze just to maintain it there. And it's okay to stay for about 24 hours. But you are going to want to wash that wound before you leave anything on it. Again, we got to get bacteria out. So that's how you can stop some bleeding. This is what some military kits contain, is hemostatic gauze. Again, this is chitosam, which is made from the company that produces SAM splits. So he kind of incorporated his name into the name of the product, which I thought was kind of cool. So Sam is a real person, and this is chitosam. So that's an option. Let's talk about cleaning. Of course, we have a little syringe here, and this is going to give you a nice jet of water. Again, we're talking about minor wounds here. We're not talking about gaping open wounds. I have trauma kits for that. You're going to need tourniquets. You're going to need other products that aren't necessarily in this kit. So we're really talking about things that have, mild to moderate bleeding, and again, not huge wounds. So this is going to take care of your smaller wounds. So you want to clean it up. If you can wash the wound, that again, just like washing your hands is the best. Washing a wound with running water, some soap is always your best bet. So make sure you clean the wound first, super important. Once it's clean, then you can put some treatment on it. We have Bactroban. We also have, bacitracin. We also have honey. Now the interesting thing about raw honey is it functions like an antibiotic ointment. So you can use either or if you prefer to use the honey. Honey is also super soothing, and it can also, of course, prevent infection. So if you want to throw a little honey on there or some bacitracin, that's up to you. If you have, let's say, a rash, something that didn't necessarily cause a cut, but it's just sort of take a layer of skin off, you may want to put some hydrocortisone cream on it just to reduce the redness and the irritation. This is also good if you have things that are swelling. Let's say you've got some bug bites or a poison ivy or some kind of rash. Hydrocortisone cream really just soothes that irritation, and it can help with itching too. So that's a really good thing. Another thing you can use as an antiseptic is a BZK. That's great for cleaning the wounds out. Again, if you don't have the soap and water, use your BZK to clean it. If you want to be doubly good, wash the wound, put some BZK on it, or some betadine, of course. Now, to apply the betadine, because this is super messy and it will get everywhere, the best bet is to pour a little bit of the betadine in the cap. Unscrew the cap. It does have a flip top if you want, but pour a little bit in the cap, and then you can take some of these sterile cotton tip applicators. Now, I have 40 of them. There's 20 packs of 2, and they're sterile. So you can use those, dip that into the betadine in the cap, apply that to the wound. Again, we're just trying to help prevent infection. I have some tools in here. If you're worried that there are some debris or splinters, you do have a glass magnifier. We have scissors if you need to expose the wound. Let's say it happened underneath some clothing, or also to cut your tapes. We have scissors. We have iris scissors. Again, if you need to cut something small or trim something, you've got some scissors. Tweezers, again, if you're looking for debris or splinters. And I do have a curved hemostat. So this is good if you did have something that you needed to pull out that was maybe a little too big for the tweezers. This is good for removing things. I guess if you get like a fish hook, that's probably not a bad thing to have to help get that out. If you do have some issues with dislocated or sprained fingers, if you possibly think it's broken, you do have a SAM splint. These are pliable and you can mold them to the shape of the finger and then use perhaps a couple wraps of ACE, or we have the self-adherent tape, which is in blue, which is kind of cool. It's also called Coflex, but it's like an ACE, but it's got a sticky side. These two are also useful if you have injuries. This is very stretchy also. Ankle injuries, knee injuries, things that you need to wrap and maybe perhaps continue on a hike or something. You need to move it out. So these are really good for orthopedic. To cover the wound, we have 10 of the 2x2 gauzes, again sterile. We have 20 of the non-adherent. Now non-adherent is best for burns because there's a big area in a burn that's going to form new tissue and it's going to try to adhere to the gauze. So you really don't want something just woven. This nice shiny side to it will help let the skin heal but not allow the skin to attach to the gauze. So you'll be able to take the gauze off without ripping off the new skin. So that's important for burns especially. We do have 20 of the large Band-Aids, and of course we give you 80 variety sizes from circles to bigger and bigger triangles. So you've got our rectangles. So you've got lots and lots of Band-Aids. I have like, you either get 60 to 80 and then 20 here. So you have like almost 100, sometimes 100, sometimes 80. The 4x4s, these are again woven. This is best for a wound that you've put a little ointment on. So again, it doesn't adhere to the wound. When you're taking these gauzes off and you're doing dressing changes, you really don't want to injure or remove clean, good skin, healing skin. So it's important to put a little bit of cream on. Orthopedic injuries, again, we had talked about the ACE and the Coflex. You also have a triangular bandage. Make a sling. Helps the person to heal, can get them out of the place you're at to get them better care. If you have something that's injured and it's bleeding, it's best to stabilize it. So if you did have some bleeding in the arm, you may want to go ahead and put a sling on there so they're not moving their arm. Movement can cause rebleeding. So anytime you can keep something from moving again, that's best. I also have ice packs, again, back to the orthopedic. Anything that's bumped, possibly going to bruise or swell, you want to shake and break these. You're just going to pop them. There's instructions on the front. Give it a little shake and then apply it to the wound. This isn't going to be terribly cold, so you don't necessarily have to have some material between this and the wound. But if they do feel that it's a little cold, you might want to put a piece of gauze between it. It just depends on the sensitivity of the person. Some more sterile gauze. We have 6-inch of the roller gauze. These are super long. I believe they're 80 inches long, and there are, again, 6 of those in here. To continue our sterile gauze, we also have some smaller ones. You may have a finger injury or a foot injury around the toe, or perhaps it's just a small person or, you know, a baby or a child. They get injured, they're probably the ones that are going to use this stuff the most. So there are 8 of the 1-inch sterile gauze. If you have a wound that you think you can close, it's obviously not terribly gaping or terribly large, I do put 100 butterfly closures in here. These are very similar to steri strips. They're shaped a little bit differently, and they are quite a good size. Let's see if I can show you one of them. They're about this size, and the wound is right in the middle. So you put one tape on one side, you pull it a little bit, and then you put the tape on the other side to keep this on and to prevent it from coming off in a shower or washing their hands, because they are going to have to wash their hands. There's something called benzoin tincture, and we have several of these. I think I give you 6 of these, and the benzoin tincture has a weird smell, and it's sort of a brown liquid. You're going to paint that on the outside of the wound that you're using the butterfly bandages. This is a tacky fluid, and what it does is it keeps the butterfly closures in place so that they don't come off the first time someone washes their hands or takes a shower. So it really helps to keep that on. We also have some liquid bandage. This is good too for closing the wounds. A lot of people think if you use super glue or this liquid bandage that you're putting it in the middle. You're not ever doing that. This is actually something that's on the outside of the wound, a small cut. You're going to close the wound edges to bring them together, and then you're going to use this on the surface. So really what you're doing is you're pulling it together a little bit, and you're creating a protection. So it's a nice layer. You're going to put 3 layers on. Do 1, let it dry, 2, let it dry, 3, let it dry. Another thing I always put in my kids is instructions. Super important. People get stressed out when someone gets hurt. You don't necessarily say, oh, I remember exactly what to do. So I've got you a little reference book. It talks about burns and cuts and injuries, even choking and CPR. So it's got a lot of really good information. So that is in your kit in case you forget. We were talking about burns and the non-adherent gauze. I do have something called burn spray. This is great. It's going to help relieve the pain of burns. Burns can be terribly, terribly painful. If you've ever had one that really opened up the skin, blistered up, you understand. Super important to have some burn spray. And then make sure you cover it up with the non-adherent. I showed the tapes, but I didn't really talk about them. I have a paper tape, which is very gentle for sensitive skin. And there are just some people that have issues with latex and the sticky substances that are on tape. So it's best to have a nice gentle tape. I do have Elasticon. This is stretchy and has a sticky side, just like the Coflex. So it's almost like a small section of the Coflex. Again, this is great. This will hold gauze on. This will protect an area that is sprained, keep it in place. it's got a lot of things that you can use this for. So Elasticon I feel is really helpful in this kit. I think I've covered everything. So there's just a lot. I pack everything, I organize it, I keep the gauze together. Everything is in plastic bags. This is a pretty good bag. It's got, you know, an interior, the bottom is probably rougher and has a little more protection, but it doesn't have a plastic on the inside. So I pack all of this just like you're seeing these in plastic bags. Everything that you see will be organized and in plastic bags so that it won't get ruined if it falls in the water or it gets rained on. Everything is protected. So anyway, this is my minor wound care kit. Thank you for listening. I really appreciate it, and have a beautiful day. Thank you again. Nurse Amy from doomandbloom.net. Take care.